Hi, everyone. Welcome to CB340B's webinar, Making 340B Visible, Communicating the Impact of 340B. We're excited to have you. We're just going to give it a couple of minutes before we get started here. If you can hear in the background, there is a tornado siren sign going on here, but there is no tornado. You might hear that. You might hear my dogs howling. But we're all good. It should be over in just a second. And I see people are coming in. So we'll give it maybe 1 or 2 more minutes and then we will get started. If you're just joining us, thank you for joining us for Making 340 Be Visible. We're looking forward to talking with you. I do think it's hilarious that today of all days, at this time of all times, is when they scheduled the tornado siren test. So, of course, never a dull moment, right? All right. All right, well, we'll go ahead and get started. We're really excited about this webinar. It's going to be hopefully really dense informationally and something that you can take back to your staff to talk about the importance of storytelling when it comes to 340B and when it comes to advocacy as well. Um, just a couple of housekeeping things. These slides will be sent out afterwards. We are also recording this so we can send it out. So if you want to share it with your staff or your community, you can do that. As we're talking about creating good stories, you can tell the story of this webinar. And the other thing that I wanted to tell you, the chat should be enabled. Famous last words, because the chat is never enabled for some reason on your guys' end. It should be. If it's not, go ahead and use the question and answer button for any comments that you have, anything like that. If you have questions throughout the webinar, we're happy to go ahead and take those. Oh, it works, Holly. Thank you. Coming in clutch. Perfect. So please use the chat. You all know that my worst nightmare is talking for the next hour straight and not having a conversation with you. So please let us know your thoughts, your questions in the chat function or in the Q&A function, and we will answer them as they come in. We'll keep an eye on it. So let's get started. So today it's going to be Grace and I. This is a CB340B webinar, pure CB340B. So if you have not met me, hi, my name is Rhiannon Klein. I'm the Executive Director of CB340B, and I'm honored to be here to talk to you guys about storytelling today. And I'm joined by Grace, who some of you may know and some of you may not know. Grace, do you want to introduce yourselves?
Yeah, it's wonderful to be with you guys today. This is actually my first webinar that I've helped lead for CV340B since I've joined the team, so I'm very excited. I serve as CV340B's Advocacy Associate. I am also an MSW student, so I eat, breathe, and sleep advocacy work. It's all I've ever done and all I want to do, so I'm excited to be here with you all.
And Grace is a patient advocate as well, which makes her even more special. So we're going to go ahead and get started, and Grace is going to be talking about how we're going to frame your message around the 340B program. Go ahead, Grace.
Yeah, so I think to start, I think the basics of any advocacy, and I think particularly for this issue with 340B and keeping the 340B program intact, advocacy starts with education. So we what CV340B does on the many things that we do is creating tangible messaging to give to stakeholders or even potential new stakeholders, non-stakeholders, um, related to how to advocate for the 340B program. So, and with that education, I think we have to ask the question, who are we talking to? You know, we tend to know that more liberal, if you want to say, audiences are more responsive to storytelling or more anecdotal related, more people centered, for lack of a better word, versus more conservative audience tend to lean more towards like the hard stats with cost effectiveness related to the 340B program in this instance. So I think that framing can be helpful. And really, I think if you and this is something I meant to put in the slides, but if you have a mixed audience or if you're not sure exactly who you're talking to, I think you can learn to marry both of those things, which we'll kind of talk about here today. And it will really be effective and impactful, because I think that that's where any good advocacy starts, is being emotional, thought-provoking, educational, and you want the person to leave feeling like they know what you're talking about, and also that they care about what you're talking about. So we have there are lots of opportunities to kind of mix and match with who you're talking to, of how we frame that messaging. But the ultimate goal, obviously, is to reach as many people as possible and to get them to care. So that's kind of what that is the basis of what we're talking about today, is like, who are you talking to first before you do anything else? Yeah.
Great. Ready for the next slide?
Yep. Another huge thing that is really important when talking about messaging framework is being able to quantify direct patient care. This is something at CV340B that we are constantly talking about, is making sure to, I guess, be able to display the patient benefit, right? I think that that's something that opposition or pharma manufacturers, whatever you want to call them, people who oppose the 340B program always bring up, is like, there is not a direct benefit. But we know that that's not true. So we need to kind of, when we're crafting the messaging that we want to give, we want it to be short and sweet. Like I said, like, if we can get your talking points to 5 bullets or less, that's ideal. Obviously, it's a little difficult with how technical the 340B program is, but I think that's something we're going to talk about too, of like maybe taking the technicality out of it a little bit. But we want to personalize our messaging as much as possible to your community. And what I mean by that is, this is how we at my clinic, my hospital, what have you, my contract pharmacy, this is how we use 340B savings. This is what that looks like. This is how many patients we've helped. I was talking with Reed about this. If we can even do like HIPAA compliant client stories of like, we had a patient that couldn't drive their car or didn't have transportation to get to the clinic, and we were able with this savings to make sure that they had transportation services. I think in the 340B space, we kind of talk really broadly sometimes, and I think the best advocacy can be giving specific examples. So that, what are you using your savings for? I think that that is kind of the basis of what we're talking about today, of quantifying it. There is direct patient benefit. Here's how. Humanize those numbers. If you can bring them into your clinic and show them, here's how our clinic's working, here are the faces of the people that are helping people, that's even more helpful. Humanize the issue, keep it short and sweet, and make sure to show tangible stats of how you're using the 340B savings. So next slide, please.
There you go.
And then we want to create a story when we're creating a messaging framework. So storytelling is one of the most effective ways to convey the importance of any issue. I think, like I was talking about, humanizing, specifically when we're talking about like policy related things, or I know that a lot of you who work in the 340B space deal with the more technical side of like, here's what the line item is in the budget related to 340B, right? Like, it's very, you deal with the day-to-day operational versions of it. But I think for people who are not aware of what 340B is, I think being able to humanize it as much as possible is really important. So we want to create an emotional and thought-provoking kind of narrative-based messaging framework, using boilerplate language. And what I mean by that is, it's like a set of language when you talk about this that's customizable for the audience that you're speaking to. So for example, if you have a good stat from your CE, or we're working on getting some stats for, I think, everybody to use related to, this is the number of patients we've been able to help get their HIV/AIDS medication or their diabetes medication. That is impactful, and that's important because they're real people. So kind of being able to build your case, I guess, or your story around a set of a framework is really important. And again, like I said at the beginning, kind of wrap around before Rhiannon gets into her more specifics of what we're talking about here today. But you want people to leave feeling like they can care about this, right? I think when we talk about public policy, at least in my experience, it can get a little abstract and frankly some areas a little boring. And so I think it always needs to go back to why should I care about that? You know, what I have my own life, right? Not just policymakers, but I'm saying like the average day-to-day person, they got stuff going on, they don't know what 340B is. Tell me why I should care about that. I think it's really important, and I think it's a good foundation to kind of message your or framework around. So, and again, as many people as we can reach, which I think is something that CV340B is talking about all the time. We want to do that. We want to break out of just the 340B space. And if you want to educate your C suite on what this means, all the way up to your neighbor, obviously your policymaker, and maybe also your policymaker staff, because let's be honest, that's probably who you're talking to anyway. They make the important decisions, as Peggy, our friend, likes to say. Um, all of that's really important, and it is the basis for being able to talk about this issue. So,
Hmm. Yeah, and Grace, you told me a story this morning, like
mm-hmm.
why this matters.
Mm-hmm.
We tend to have these policy conversations in very sterile boardrooms with policy people or with influence makers. But it's and when you get into those places, it's like, well, we feel like we're doing pretty good because
Mm-hmm.
we've accomplished X, Y, Z. But then you had this experience this week. Will you tell us a little bit about that?
Yeah, so I am interning at another org related to like criminal justice for my MSW program, and so I've been very fortunate to be able to work with them and get my practicum hours there. But one of their initiatives is to kind of improve the living conditions of youth living in facilities like detention facilities, and so I was very privileged to. I was invited to go and tour one of those facilities with them and like really go talk to the youth that live there and say, hey, how are things going? What are areas that can be improved? What are things that are going well? And it was shocking. It was shocking, but it was a good thing to like, I think, bear witness to. I think that's what Ria and I were talking about is we want people to, it needs to feel tangible, right? Because I think in that issue, the topic of kids in jail, nobody wants to think about that. So they're not
Mm-hmm.
going to think about that. And those in charge might be like, well, we're doing a good job because nobody's telling us that we're not doing a good job. So I
Mm-hmm.
think related to uh, this area and healthcare in general, people need to see like our clinic won't run here. This is what our clinic is. It's a real place. These are real people. These are real community members, specifically policymakers, I believe. They need to be able to bear witness to what's happening. And I feel like we get a lot of lip service from some policymakers in general. I think about like we're working on the issue, we care. Well, show me that you care and make them care, and bring public
Mm-hmm.
attention to it. Bear witness to um, without without 340B, there are people who will go without life saving medication, and that is a big deal. And they need to look at them and tell them why they want to change this program. And if you can facilitate that, I think that that's the most important. But even if you can't directly facilitate talking to a patient, they need to look at the people who work in it day to day, like the people on this webinar, and say, hey, we have real people that we take care of. They're real human beings. And I would like you to look at us in the face and tell us, you know, why you want to make changes or why you don't want this program to be around anymore, things like that. So,
Mm-hmm.
yeah, I think storytelling and holding people's feet to the fire, that's my favorite activity.
Mm-hmm.
Really, just like I think a large part of advocacy is just bearing witness and listening, um,
Yeah.
and being able to formulate a story around that. So,
Yeah, storytelling is one of the most powerful ways that we can bear witness to what is happening. And so, just like as Grace was talking about this children's detention center, these kids are telling reporting that there were some pretty dire things happening. And
right.
meanwhile, on the other side of it, the administration of the detention center was saying, well, we're doing a great job, right?
Yeah.
We're doing a
Yeah.
great job at all of this. And I do see that as a parallel between, covered entities and policymakers or covered entities and community and things like that is we as covered entity stakeholders, we see what's really going on the ground with people losing health insurance at a massive rate, people not being able to afford their primary care, not being rationing their, diabetes medications and insulin. Um, things are things are not all hunky dory on the ground,
Mhm.
and so we do really have to bear witness through storytelling to move the needle on. on the 340B program advocacy.
Yep.
So Grace talked a lot about, or talked a little bit about choosing the right audience. Making 340B visible starts with identifying your audience and making sure that you know that what you're saying to them is going to land. So different audiences care about different impacts. And we talked a little bit about that when we're talking about liberal audiences versus conservative audiences. But we are going to dive a little bit deeper into that when we're talking about things like the difference between talking to your staff about 340B and the talking to your community or your patients about 340B. So tailoring your message to what matters most to them, not what matters most to you, is the key in effective storytelling. A lot of times, when we're trying to convince somebody else of something, um, like I'm trying to convince my daughter that celery won't kill her, right? I'm talking about what matters most to me, which is celery is a vegetable and celery has a lot of water, so it's going to hydrate you. She couldn't care less. So I have to kind of change that message and say, celery is fun to eat. Here's how we make it fun. Here's some peanut butter. Celery is crunchy and it's exciting and it tastes interesting in your mouth and it's, all of those things that matter to her rather than matter to me. Um, the same 340B story is not going to resonate equally everywhere, right? And I think a good um, a good example of this is that you can go to two different policymakers' audiences. So you can go to a liberal policymaker and a conservative policymaker, and both, if you say tell the same story at both offices, you're not going to get the same reaction because their value bases are completely different. So you need to really hone in on not only what specifically that party wants to hear, but specifically what that office wants to hear. For example, Senator Debbie Stabenow just retired. And I knew that Senator Stabenow was big into the Farm Bill. She was big into rural Michigan. And so when I would go into her office to talk about 340B, not only would I talk about some of those liberal talking points that were really important to her, I would also tie in rural talking points and talking points about farmers specifically. Farmers don't, just they don't have a place to get health insurance. And so there are those times when farmers slip through the cracks and they have to get their primary care at places like FQHCs. And so making sure that you are tailoring your story to the correct audience. Um, Emily says, this is why I painfully change my advocacy points with this administration and say that we need 340B to continue the mission of this administration to end HIV epidemic. Yes. And without 340B, we cannot continue your mission. Exactly. That's perfect. And then I might need to start offering a gold trophy or something. I think, yeah, maybe we should start bringing little like gold star stickers. Here, you have a gold star now. Um, Effective communication begins with understanding who you're speaking to. This does require a little bit of research, right? And some of this will come very intuitively to you, and some of it will be a little bit more difficult. So, for example, like what Emily said, right? Um, it doesn't come intuitively to some of us to speak in a way that this administration would respond to. And so we have to think through it and we have to go, okay, this administration cares about, being seen publicly. They care about accomplishing goals publicly. Everything is very front facing. So let's think about how we could speak to this administration in a way that is both professional and collaborative to be able to get done what needs to be gotten done. So who needs to hear your 340B story? This is going to be extremely personal for each and every one of you. there are a number of stakeholders that we suggest that need to hear your 340B stories, but you're going to be able to answer this question for yourself. Some of the stakeholders in your community that we think might be um, good audience members would be patients and patient advocates in your community. Um, there are a number of patient advocacy organizations out there who are funded by pharma and are putting out a message that is full of misinformation about the 340B program. Those places are where patients typically get their information. And so the fact that they are being used as a tool to kind of influence the public about negatively about the 340B program is really problematic. And so one of the biggest groups of audiences out there that I think is getting missed or is getting misinformation are patients. And again, that's because of the patient advocacy organizations. Um, local media. Local media, I don't know if you guys are a part of your local, county Facebook pages, but there are constantly local media reporters on there saying, "Hey, does anybody have a good story? Is there a story that you think we should run?" And so local media is constantly desperately seeking something to talk about, and being able to give that story to them will then start to build a relationship that can be really helpful later on in your organization. Community leaders and organizations. So here we're talking about things like the Chamber of Commerce. The Chamber of Commerce has a vested interest in the 340B program because without healthy workers, there is no commerce. So these are organizations that you can think about as an audience. What do they care about? They care about their businesses running well, and their staffers being healthy. So this is another audience you can think about. Local elected officials, and also nationally elected officials. I think that most of the 340B stakeholder community is fairly comfortable speaking to your policymakers. Certainly those of you who are on this webinar are, but it's always worth thinking and reviewing what you say to each of these policymakers. Healthcare partners and providers. This is your staff, the people that you work with every day, people internal to your organization, and then the broader public. I describe the broader public as people who come to your backyard neighborhood barbecue. If I go to another barbecue and somebody asks me, "What do you do for a living?" And I say, "Oh, I work for an advocacy organization that advocates for the 340B program," and they kind of look at me with that blank stare, I'm like, just mortified, right? Like, oh, now I have to explain all of this. And so the broader public are the people that don't have access or don't have regular contact with like a healthcare person, but they're just kind of out there living their lives, happy and carefree, and have no idea what 340B is. So the question that we want to ask here is, who is influencing the public perception of healthcare in your community? Who are those grass top people who are the change makers, the influence makers in your community? Those are the people. Once you've identified those groups of people, those are the people that you want to be telling your stories to. So when we dive in, again, I think most of you are probably fairly comfortable with talking to policymakers, but what do they really want to know? So across the spectrum of policymakers and policymakers staff, as Grace said, more often than not, you're sitting across from a 21-year-old who has worked on Capitol Hill for 3 months. They want to know a few key things. They're focused on impact and they're focused on accountability. And so the first one, impact. How does 340B improve access to care? What is the impact of the 340B program? They want to know the number of patients that you're serving. How many people are you actually seeing on a day-to-day basis? How many providers do you have? How many staff members do you have? Again, when we're talking about the liberal messaging versus the conservative messaging, right now, at least until November, we have a very conservative government all the way through. So when we're talking about numbers, one of the most influential numbers that you can say to a conservative lawmaker is how many people you employ, and what any cuts of 340B would do to that number of people that are employed there. Many of you know Logan at FQHC Compliance. He recently shared an article of his former healthcare center that had to cut a bunch of staff. It's a big um, emotional draw for the conservative audience, and a needle mover is what I would call it. Services supported through 340B savings. This is a great one for our liberal friends. What services are you supporting through 340B savings? Do you have wraparound care like Grace was talking about? Do you have transportation? Do you have a mobile clinic? Do you have diabetes care program? Things like that. Are you doing vaccines? What are the services that are being supported through the 340B savings, and how are they impacting your patients? And then local community benefits. So this is like a food pantry, all of that kind of stuff. This is another um, really great talking point for our liberal friends. When we are in the room with policymakers, there are a few things that you really want to focus on. First, your community impact, the economic value, and then real patient outcomes. We want to be that person that is bearing witness for our patients, and making sure that we connect the 340B program with a direct patient outcome. Including data is really important, that will supplement your story whenever possible. I'm going to give you a little caveat, and we'll talk a little bit about this later too. Your whole story cannot be a list of data points. Does that make sense? Your data points are there to support your storytelling. Your storytelling is not there to support your data. So we need to start with the story, support it with the data, rather than starting with the data and trying to wrap a story around it. Building internal alignment. Very important. I would maybe say the most important thing that you do as a 340B storyteller, to educate your staff on what 340B actually is. Um, Many times when we're talking to either the board of an organization or the providers, the direct patient care providers, the nurses, the social workers about 340B, they have no idea. And so the internal audiences help amplify your story when they have the information that they need from you. It's important that you share a mission-driven outlook or a mission-driven um, 340B savings support story. How does 340B savings directly support the mission of your organization and the ability for your organization to accomplish the goals that you've set for yourself? Um, this can be as easy as just a quick sentence. 340B savings support basically everything in our mission-driven services. Here's how. 3 bullet points, 4 bullet points, 5 bullet points. The role that staff play in delivering 340B supported care. Once you have told your staff how important the 340B savings are to your overall mission, it's important to tie in the idea that the staff are playing the most integral part in delivering 340B supported care. It allows them to feel, to take ownership over the 340B program, knowing that they are actually the ones that are walking it out. And this can be tricky when you're talking to staff like HR or you're talking to um, marketing or finance or something like that because they are not patient facing, but there are still things that marketing and finance, I mean, finance especially, right, are going to be the roles that they're going to be playing in delivering 340B supported care. Um,
And sorry, I just wanted to add to that really quickly. I do think that if you can pick, if you're starting your advocacy like framework, I think starting with internal stakeholders is really important. One, they're a good tester on what messaging is working, because
mhm.
you're probably comfortable with them if you know them, and also um, they can help you then advocate to more external like policymakers and things if they understand their role and what they're doing. So if you can take an inside out approach, that would be helpful. But
Yeah, I that's a really good amplification. Um, you have to start with staff before you can kind of move on to everybody else. The next thing is make sure to give a really clear example of how your staff is reinvesting into patient care through the 340B program, and highlight the strategic importance of your program to your organization. Why does this matter to the future of your covered entity? So the goal here is to create internal champions who can then confidently explain the program to external partners. CB340B has covered entity education that we can give you. We can also come in and do lunch and learns for you. So if you need you don't know where to start and you just need something to start educating your staff, we're happy to come in and do lunch and learn for an hour and talk about the importance of the 340B program and hit all of these points for you. So numbers help demonstrate impact. So this is where we're talking about the importance of data. So data makes your story credible. Um, Examples are numbers of patients served annually, prescriptions supported through 340B, cost saving programs for patients, programs funded through 340B savings, expanded services made possible. Think in terms of measurable patient benefit. Again, one of the biggest things that pharmaceutical manufacturers are saying is that 340B is not making it to the patient. And we all know that that's not true. But it's important that when we are crafting our story, we are using data that supports the our thesis of 340B is helping our patients. Um, Wade says, don't forget to include your board of directors as they already bring lots of community context and relations with the elected leaders. That's such a great point for our previous slide, Wade. One of the audiences that we do tend to forget when we're talking internal is that board of directors, and they can be so influential in our communities. Um, One of the places, if you're an FQHC, that you can do this is at NAC Chai. A lot of the board members do come to those NAC Chai events or the NAC P&I events, and they seem to be very engaged there. So that's a place that you can educate them on the 340B program. When we're talking about using data in stories, like I said before, data makes your story credible. The story is not run by the data. And so if you have a story, for example, of a patient who comes in needing care for a heart condition, then you can use the patient's story about needing care for condition to highlight how many patients you have currently on blood thinners or how many patients you have currently who need the same type of care that this patient needs with their heart condition. How much does it cost to get those medications with 340B, without 340B? What are the patient's cost savings? Are they getting a sliding fee scale for their primary care? Are they getting discounted medications? Are they getting labs or anything like that? That's how you use data to support your story rather than the other way around. So, the big takeaway here is make sure that you're thinking in terms of measurable patient benefit, like we said, and make sure that your data is supporting your story, not the other way around. Numbers inform, stories inspire. Data alone rarely moves people into action. This is true also, even I know that as a community, it's been kind of pounded into our heads that conservative lawmakers and conservative policymakers want data. Yes, but that's not going to move the needle exclusively. Um, and I'll give you this story as kind of an example. There was a hearing a few months ago, and 340B was coming up, and as each of the members had their questions, it came to one member where that I was really nervous about, and they were a conservative lawmaker. I wasn't sure how much 340B they knew. They were fairly new to the committee. And I was like, oh gosh, this is just going to be a nightmare because they're going to do, pharma's talking points, and it's going to be, just they're going to ask silly questions. He started his question time by telling a story about one of the health centers in his district that he had gone and toured. And he talked about the patients there and the providers there and the impact that it had made on him personally. And I was so thankful to whatever health center that was that they had gotten to this member who was a very fairly new member and had already had him back to their health center to do a tour, and it had stuck with him. So yes, we can give him all of the data in the world, but sometimes it just takes that kind of emotional story or that experience in the health center to really move the needle. Stories help audience understand what the numbers mean in real life, how patient experiences care, and why programs matter to communities. So combining the data and the narrative to communicate impact effectively is going to be your number one goal. So let's see, is there anything that I missed on this slide that I want to talk more about?
I just wanted to, we didn't put in the slide, but this made me think of this. I think if you can build relationships too, and kind of
Mhm.
have an ongoing educational relationship with policymakers, their offices, other stakeholders, I think what Rhiannon just pointed out that like one time talking about data, clearly like that lawmaker, he's probably been ingratiated in his rural community and talked to rural community members about why this matters for them, hopefully. So if it can be an ongoing conversation, not just when they're having a hearing, but like trying to create those relationships, I think is really important and will move the needle more than you think it will.
Mhm.
Something else to think about.
Yeah, because it really brings to life what they're saying. You can go to a lawmaker and say, we have 121 people who are participating in, a diabetes wraparound care. And that's great. But until that lawmaker hears a story about how that wraparound care impacted one of those patients, it's not really going to mean anything to them. All right. Collect stories before you need them. If you don't have a story repository, this is your sign to get one. And it's even better if you have some way of collecting stories from your providers as well. So you're not necessarily um, depending only on you and your encounters with these stories. But now that you've educated your providers and you've educated your staff, those staff become ways for you to build that repository as well. It's important to build an internal collection of these patient stories, um, so that when you are on the fly, or let's say you're in an airplane and you're headed to DC and, Senator so and so is sitting in business class and you recognize him, you have a story, you know where to find it, it's organized, and you can pull it up and you can review it before you go over and say, "Hi, Senator, here's a story that I want to tell you." Um, Sources for these stories may include patient success stories, provider experiences, program impact examples, and community partnerships. Creating a system to capture and store those stories regularly is super important. So this could be as easy and simple as a Google form that you send out to your staff in your staff emails. And remind them every so often. We have a Google form. If you have a patient experience or a provider experience that you want to share about the 340B program, feel free to put them in there. And then you can either keep your stories in the Google form as a way of being a repository, but oftentimes it can be difficult to sort through them. I would suggest rather than keeping them in that Google form to take them out. You can export out of a Google form into something like, if you're an Excel person, into an Excel spreadsheet, where you can track where you got the story, um, who you think the story, like what audience you think the story would be most applicable to, and if you have any follow-up questions from the person that submitted the story. That way you have a really clear way of sorting through. If you see again that conservative senator on the airplane, you can go straight to your Excel spreadsheet, hit the filter for conservative stories that you think would be helpful, and you can find all of the stories that you have in your reservoir. This is something that I don't think enough people do. And it's really going to ease your anxiety when you're in unplanned situations where you have to explain the 340B program. So do yourself a favor, and start creating that internal reservoir of stories so that you have somewhere to pull from when you need it. Okay. Center the patient. We talked about this a little bit, but let's kind of dive more into it. So your messaging should focus on patient impact, not just organizational benefit. Here's the difference between the two. The 340B program was intended to allow organizations to stretch scarce federal resources to provide more and better care to their patients. A lot of times, as a 340B stakeholder community, we can get caught up in that first part where we're talking about how important the 340B program is to the organization. And that's super important. We need to have that message out there. We need to be very clear that this is not a direct to patient benefit. So this isn't a discount card. This isn't something where patients can say, "Hey, I want the 340B discount." This is a program that benefits the organization so that the organization can then help the patient. When we're telling our story, we can't get hung up on that first part, and we have to kind of shift our focus and think 340B benefits our patients and the community. How? So how do patients receive care? How do patients receive care they might otherwise miss? Um, how do services expand access in the community? And how do programs improve patient outcomes? I saw a question in the chat. We will send this out after the call. And then we also have it's recording right now, so we'll send the recording too. So shift your focus from how does 340B support our organization to how does 340B support the patients, the services in the community, and the programs that improve those patients' outcomes. And focus your story on the patient and the community benefit of the 340B program. I'm going to tell you, it's very important when you're talking to your policymakers that you make it very clear that 340B was written intentionally to benefit the organization. So don't drop it entirely. It's incredibly important for us to maintain that the 340B program is intentionally written the way that it was written to support the organization. But we can't stop there. We have to move on and we have to definitely highlight the patient care and how patients are being impacted. So, what makes a story effective? Strong stories are clear and easy to understand, focused on a single patient or experience. So this could be a single patient or a service that you provide through the 340B program. Grounded in real outcomes, connected to community impact. Keep it simple and authentic. So clear and easy to understand. We just kind of like every industry have our own um, shortened language. We talk about things in, you know, in kind of our own little dialect. And so, in order to communicate a story that is going to be received well, we need to drop our own dialect and speak in a way that you would speak to your neighbor and take time to explain what is happening. For example, um, CB 340B is currently working on something called the 340B Litigation Defense Fund. We've just started this. And in every one of our regional advocacy calls, we have 5 of them a month, and they're all over the country, and they last for about an hour, and we give an update. So in every one of those calls, we give an update on litigation and what's happening in the 340B world as it pertains to contract pharmacy access um, and the circuit courts. Well, it's super easy for us as lawyers or lawyer adjacent. I play a lawyer on TV. I'm not actually a lawyer. To just say things like, "Hey, um, there's a potential split in the 10th Circuit, and we need to intervene because if we don't intervene, then we won't get the outcome that we want." Well, there's a lot in there to unpack. First of all, where's the 10th Circuit? What is a circuit court? Second of all, what does it mean to intervene? And isn't somebody already arguing that case? And how do we, it, the message gets lost. And so recently, what we've been doing is explaining intervention by saying the state's attorney generals are like the primary care generalist, right? They know a lot of information about an inch deep. But interventionists, our stakeholders, are like the specialty care doctors or a neurologist. They know a lot of information about one subject. And so that's why it's important for us to intervene in these cases. So make sure that your stories are clear and in layman's language and easy to understand. Focused on a single patient or experience. This is what we were talking about, like the heart patient. When you're drafting your story or you have that story repository that you're going through, think about, okay, this is one single patient. How can I add to this patient's story as the base to make my points? It's going to be grounded in real outcomes. Um, Oftentimes, it's difficult to um, tell a story about a patient because a patient is a moving target. That patient that has a heart condition in that moment was looking for blood thinners and was able to access care and a support group because of 340B. Um, Ground it in a real outcome by saying that patient was able to get their medication and get connected to a support group. That's your real outcome. Your real outcome is not going to be the patient recovered from heart disease, right? Because you don't have that information yet. Just whatever information you have about the outcome of that patient's story, make sure it's grounded there. I understand that's difficult because, like I said, patients are a little bit of a moving target. Um, Connected to community impact. So that's pretty easy, right? How does this affect the community? The patient with heart disease is an employee. He's a father, he's a grandfather, and the impact is that the employer gets their employee back. The father, the kids of the father get their father, and the grandkids get their grandfather. Keep it simple, keep it authentic, keep it real to who you are. All right, 151. All right, we're going to go through these last slides a little bit quick. Story needs tension. Every compelling story includes both a protagonist and an antagonist. Examples include a lack of access to affordable medications, barriers to healthcare services, and health inequalities in the community. 340B helps to remove or reduce these barriers. Always identify your protagonist and your antagonist when you are telling a story. Otherwise, your story is just going to feel unstructured. Your protagonist typically is going to be the patient or the community member seeking care, and the antagonist could really be either the challenge that or the barrier that they're facing, or it could be pharmaceutical manufacturers, or it could be the state when we're talking about Medicaid carve out, or it could be any number of things. But be very clear about who the protagonist and who the antagonists are, so that your story feels structured and authentic and easily understandable. Okay, here is a simple story structure, and I put a little picture of a kid with his puppet because storytelling is something so basic to humanity that it can almost come intuitively. And so you may be a storyteller already and you hadn't thought about these four storytelling structures, but you may be already doing this. So give yourself, permission to be intuitive about the way that you are creating your stories. This simple storytelling structure starts with the situation, which in this example could be a patient or a community that faces a healthcare challenge. The barrier, so again, we've identified our protagonist, right? The situation, and in the barrier, we're going to identify our antagonist, which is access, cost, services created, obstacles to care. It could be pharmaceutical manufacturers. It could be the state. Again, your antagonist is going to change. The intervention. So the intervention could be something that has happened, or the intervention could be something that you would like to happen. So the intervention could be the 340B supported programs that provide the support, or the intervention could be, I'm asking you, policymaker, to please support the 340B program. And then you move on to the outcome so that our patients can have improved health, access to care, or quality of life. Does that make sense? So you're going to have the first and the second, and then your roads are going to diverge depending on what situation or what audience you have. You are either telling about an intervention or you are telling them that you need them to do something. So this structure is going to help audiences see the impact super, super clearly. And if you remember those four parts of the story structure, you'll be able to really tell any story. I should have made a good little anagram. Or is it not an anagram? What is the word that I'm looking for? You know what I'm talking about? I can't remember what the word is, but I should have made it but it's like SBO. It's not a good
You
one.
mean like a Venn diagram, like the circles? Is that what you're talking about?
No, like when the letter means something.
Oh,
Felicity.
yeah, yeah.
I know.
I know the word
Um,
too, and I can't think of it either.
I'll think of it. I'll think of it after the webinar, you guys. Okay, so making 340B visible in your community. After this webinar, you have a little bit of homework, 5 things. You want to identify your key audiences, gather both data and stories. Remember, we're doing story first and then data about your program's impact. Create a system to collect patient stories. That could be your Google form, your Excel spreadsheet, acronym, Emily. Thank you. Um, your Excel spreadsheet, something like that. And then equip your staff and your leadership, your board meetings. I know January, it's been a long day already. Equip your staff and your leadership with clear messaging, and then share your 340B story with your community. So visibility builds understanding, trust, and support. Remember, our jobs as 340B stakeholders are to bear witness to the incredible things that are happening because of the 340B programs. And please don't let pharmaceutical manufacturers' misinformation derail you from effectively communicating the most beautiful stories that you can about the good that 340B is doing, because we can get bogged down in doing the tick for tack with pharmaceutical manufacturers. They say, we say, they say, we say. I don't think that that's useful. I think that we lead from our strength, we ground ourselves in our stories, and we advocate from there. And so I hope this helps you to bear witness to the good that 340B does in your community. And I hope that this felt meaty for you. We will definitely put this out via email to everybody who registered. Make sure that you have it. If this is something that you want to teach your staff to do, let us know, and we're happy to do that as well. Before we wrap up, there's about 3 minutes left. If you have any questions, please let me know in the chat. Let's see. Do we have a question, Grace? One
No, I think it
question.
was just,
Oh,
I,
ACE said acronym. Thanks, ACE.
yeah.
Oh gosh, you guys
Um,
are the best.
I did want
Um,
to mention if you guys need help specifically crafting your stories, please reach out to us. That's our like bread and butter. And I know we kind of talked in more of a broad way of doing this, but if you're like, hey, I need help, I don't know, taking all these stories and these numbers that we have and making them into something cohesive, we're happy to help with that. So please reach out.
yeah. Yeah, if you didn't know it already, Grace and I are storytellers, so we would
Mhm.
love to do that. So,
Yeah, I choose to
thank
use my
you.
talk for good and not evil. So
Yeah, exactly.
yeah,
I'm a chatterbox. I want to use it for good. So,
right.
yes.
Thank
Awesome.
you
Well,
guys.
thanks everybody. I hope you have a wonderful rest of your day. We will have this up on YouTube and in your email as soon as we have it ready for you. Have a wonderful rest of your day, and we look forward to seeing you again.
Thank you.
Thanks. Bye.